Dr. Strasser, you were at my office, Dr. Craig Kohler's in Wilmette, Illinois, and we did some training on the microscope this weekend. Why don't you tell me a little bit about your experience with your wonderful staff here and how you enjoyed doing it?
We had a wonderful experience. Stacy and Ann were kind enough to let me practice using the microscopes, the different microscopes that are in the office. One of the biggest issues I had with my scope was positioning the patient, so I was able to come in and watch you, Dr. Kohler, and see how you position your patients in order to get the best clinical experience you can, and I feel like we really made some headway over this weekend, and I'm excited to go home and start using mine and expand what I'm doing with the microscope. It's a good experience.
And what was the hurdle that you had in terms of learning about the microscope to begin with?
One of the biggest hurdles I have is that what I needed to do with the microscope is exactly the opposite of what I wanted to do with it, which is one of the biggest frustrations for me. And getting in the right position, I'm able to position myself better in your office than I can in my own, so that's something we'll change when we get home. So just knowing where to put the patient, how to position their head, how to get the patient to move without my having to move and constantly readjust the microscope is a big challenge, which I'm really excited that I feel like we conquered that. So.
And using a patient versus a model, could you comment on the difference?
Oh, absolutely. I was cheating all the time with the models. We've done lots of lab courses with the microscope, and I enjoy them to no end. But the problem is that I can position my hand in the model right where I want it, and I don't really have to work hard because I don't have to move the microscope. So this was a little more of a challenge, learning how to get it actually in focus and work at the right level for what I was doing, and actually use the different levels of magnification. Big improvement. And
how long were you actually here at the office?
Total time, we spent the morning today, so we had 5 hours today and about 5 hours yesterday. I think that's about right.
Yes. Now, Stacy, yesterday you were the patient. What was your experience being a patient with a microscope? How did you feel about it? And tell us your story.
It was nice. It was nice to see Dr. strive towards her goal and being able to go back to our office and use the microscope, and I was very comfortable, and it's neat to see the process.
And what about you, Ann? You were the dental assistant yesterday. What was your perspective being a dental assistant for 6 years, using a microscope versus what you've been used to in the past?
I thought it was really neat to be able to see it magnified and to be able to see what the doctor was actually seeing and to help out in that perspective.
And so having it, the magnification on a large screen really made a huge difference for you.
Mm-hmm. Yes.
Now today you were a patient. How did you feel about that?
Great, and I think Dr. Strasser did an excellent job.
Well, she really is a fabulous dentist, and you're very fortunate to work with someone with such a good ability and fine credentials. So thank you very much, and we'll talk to you soon.
Thank you.